Lives have certainly changed since the COVID-19 pandemic began, but some health officials say there is a second pandemic on our hands, and that is mental health. Channel 3 Eyewitness News reporter Shantae Passmore explains why the state is taking a closer look at a specific age group.
On the outside, you'd never know Liz Surratt feels a bit anxious. Mental health can appear invisible, says the 21-year-old, and through the pandemic, she's witnessed the toll COVID-19 has taken on her peers.
It almost took us that point of not normalizing it anymore and just saying, okay, it's not normal that I'm feeling this way.
Even during our meetup, the University of New Haven senior tells me she's learning how to control her anxiety. It's something she's working on with her therapist through the school's counseling and psychological services. She makes it clear this battle began pre-pandemic.
I do think it's very important to highlight the fact that mental health has always been an issue.
But she says the pandemic did heighten her stress. The state is aware there are many more stories like Surratt's. That's why the governor announced a new funding program will help colleges and universities tackle their response to mental health brought upon by the pandemic.
Make sure that the universities have some of the additional federal funding, have their resources they need to bring in, trained therapists, to bring in counselors, to bring in coaches.
The university says the move comes at a critical time when demand for counseling services is high. If awarded the grant, UNH plans to provide personalized resources for students, which would include expanding counseling services. Surratt says the aid is essential.
It's essential because if students aren't mentally well, how are they going to be able to perform in all of their classes?
The funding is expected to help more than 130,000 undergraduate students in Connecticut. Without mental health support, the fear is it could create long-lasting harmful effects ranging from more students dropping out to higher rates of anxiety and depression. Reporting from the University of New Haven tonight, Shantae Passmore, Channel 3 Eyewitness News.